ischemia. So basically from this topic you guys have to understand of the organs in our body that become ischemic very easily. So first of all, what is ischemia? Basically it is inadequate blood supply to meet the demand of the body. It is called ischemia. And how that ischemia will occur? Basically when you decrease the arterial perfusion in the example of atherosclerosis, when you decrease the venous drainage in the example of testicular torsion, Budd carrier syndrome, and also if you get the shock. In all these conditions your body will not get the adequate oxygen, adequate blood, so your body will undergo ischemia. Then after that you guys have to remember what are the organs, what are the regions in our body that are going to be more vulnerable to hypoxia and ischemia. So basically the brain, in the brain we have the region where the ACA, MCA and PCA are going to meet, like anterior cerebral artery, middle cerebral and posterior cerebral artery. The regions where these arteries are going to be meet, or you can say the regions where the branches of two arteries are going to meet, and those branches, those distal branches of the arteries don't have limited collateral vascularity. Those are called boundary areas or watershed areas. So please keep in mind what is watershed area or what is border zone area. Basically these are the areas which receive blood supply from the distal branches of two arteries, and these areas don't have collateral blood supply. So it's mean if they don't have collateral blood supply, they are going to be injured more. And what are the regions where these watershed areas are present? So these areas are present where the anterior cerebral artery is going to meet with middle and the middle is going to meet with PCA. So this is the important example. Then in your heart, like the subendocardium of the left ventricle is going to be injured more. Then in the kidney, your proximal tubule segment, straight segment of the proximal tubule in the medulla, then your thick ascending limb of loop of Henle in the medulla. These are the two organs which are more vulnerable to hypoxia and ischemia. Then in the liver, the area around the central zone, which is called zone 3, is going to be injured more. Then in the colon, the splenic fracture, which is called Griffith point, and the rectosigmoid junction, which is called Sedgwick point. So these are the areas which are going to be injured more. Then this is the definition of watershed area, which I already explained. Watershed areas are receive blood supply from most distal branches of two arteries with limited collateral vascularity. So basically what is watershed area? These are the areas which receive blood supply from the two arteries distal branches. Like let's suppose these are the two arteries, and these arteries are giving these distal branches. So these distal branches are going to, let's suppose, feed this area, the star area. So this star area is called watershed area. But the problem is that this watershed area is not having they're not having any collateral circulation like from this side. So it's mean if you damage these distal arteries branches, so this area is going to be ischemic, or you can say this area is going to get more hypoxic injury. So that's why they mention here. Then these areas are susceptible to ischemia from hypoperfusion. If the less blood is going to your brain, the less blood is going to your brain, it's mean hypoperfusion. Then neurons most vulnerable to hypoxic ischemic insult, including the Purkinje cell of cerebellum, pyramidal cell of hippocampus and neocortex. So these are the examples, you can say, in which the cerebellum, you can say the cells of the cerebellum, or you can say the cells of hippocampus or neocortex are going to be injured more. So they can ask from you in exam, please mention the cells of cerebellum which are going to be injured more. Please mention the cells of hippocampus and neocortex that are going to be injured more. So pyramidal cells of hippocampus and neocortex, Purkinje cells of cerebellum, these are the cells which are going to be injured more. So these are the, you can say, the important topics you guys have to prepare from the first aid.